Good morning. It's my pleasure this morning to welcome everybody to the press conference for the release of the Surgeon General's call to action to support breastfeeding. I would like to begin by introducing to you the 18th Surgeon General of the United States Public Health Service, Dr. Regina M. Benjamin. As America's doctor, Dr. Benjamin provides the public with the best scientific information available on how to improve their health and the health of the nation. Throughout her career, Dr. Benjamin has forged new paths and showed unprecedented leadership and devoted service at the local, state, national, and international levels. In 1987, she founded the Bayou La Batre Rural Health Clinic in Alabama, and by 1995, she had become both the first physician under the age of 40 and the first African-American woman elected to the American Medical Association Board of Trustees. In 1998, Dr. Benjamin received the Nelson Mandela Award for Health and Human Rights, and in 2002, she became the first African-American female president of a state medical society. In 2006, Pope Benedict awarded Dr. Benjamin the Papal Cross Pro Ecclesia e Pontifice for the Church and the Pontiff, reserved for those who have given distinguished service both at the Vatican and in the wider Church alike, and only 2 years later, she received the MacArthur Genius Award. Dr. Benjamin is a member of the National Academy of Sciences Institute of Medicine and a fellow of the American Academy of Family Physicians. Her call to support breastfeeding is her newest demonstration of her lifelong commitment to compassionate leadership and inspiring creative problem solving. Dr. Benjamin's consistent commitment is perhaps best illustrated by the longevity of her remarks. In 2000, upon receiving the National Caring Award established in honor of Mother Teresa, Dr. Benjamin astutely said, "It's one of those things that you start to learn when you are part of a community. You do what you know is right, and what you know can make a difference in people's lives." Truly, this is the wisdom and the many opportunities we all have to make breastfeeding easier. It's my pleasure to welcome Dr. Benjamin to George Washington University. Thank you.
Thank you, and good morning. Thank you, Dean Goldman, for your kind introduction, and I'd also like to thank the George Washington University for allowing us to use this wonderful facility. And George Washington has been very supportive of breastfeeding and very committed to our cause. In fact, Dean Goldman just told me her father was a breastfeeding immunologist, so she grew up in this whole arena. Diane Knapp, want to stand up for us? And actually your husband too, is the wife of GW president. She's a nutritionist and active in GW's Urban Food Task Force. And we have Lori Goldman, the wife of the GW provost, Stephen Learman. Would you stand up, Lori, and let people meet you? Prior to coming to Washington a year ago, Lori worked as a lactation consultant at Boston Hospital, and she taught childbirth preparation classes and pediatric first aid. She's in the process of becoming a certified Lactation League leader here in DC and is working with GW graduates to provide breastfeeding support for new mothers. So they have a real commitment to our cause. I see a number of people here that I'm really pleased that you're here, but I do want to recognize Dr. Judith Palfrey, the immediate past president of the American Academy of Pediatrics. And because the lights are high, I can't really tell the rest of you, but I'm sure I'm glad you're all here. And thank you really for being here today for the release of my Surgeon General's call to action to support breastfeeding. You know, prevention is the foundation of my work. It's the foundation of the public health system, and it's also the foundation of my work as Surgeon General. One of the most highly effective preventive measures a mother can take is to protect her child and her own health, is to breastfeed. Given the importance of breastfeeding for the health and well-being of mothers and children, it is critical that we take action across this country to support breastfeeding. We know that breastfeeding has health benefits. It protects babies from infections and illnesses such as diarrhea, ear infections, and pneumonia. And breastfeeding babies who are breastfed are less likely to develop asthma. We also know that children who are exclusively breastfed for the first 6 months of life are less likely to become obese. And breastfeeding also reduces the risk of sudden infant death syndrome. And many people don't realize that breastfeeding has important health benefits for the mother as well. Mothers who breastfeed have a decreased risk of breast cancer and of ovarian cancer. And there are also some economic benefits for breastfeeding. Families who follow the optimal breastfeeding practices can save anywhere from $1,200 to $1,500 on infant formula in the first year alone. And a study that was published by the Journal of Pediatrics estimated that if 90% of the U.S. families followed the guidelines to breastfeed exclusively for 6 months, the U.S. would save $13 billion a year from reduced medical and other costs. And while we know that 75% of mothers start out breastfeeding, only 13% of the babies are exclusively breastfed by the time they get to 6 months. And these rates are even lower for African American women and their infants. It's apparent that something happens between the time that many women start to breastfeed and the first 6 months of life that cause that rapid drop-off in the breastfeeding rates. So this call to action suggests that there are too many barriers that exist for mothers who want to breastfeed. The barriers are encountered at home, at work, and in the community. Some examples are a lack of knowledge. While breastfeeding is considered a natural skill, some mothers may need some education to help and guidance. And lactation problems. Without good support, many women may have problems with breastfeeding, and many of these problems are often avoided if they're identified early and treated early. And we also have social norms that are a barrier. Many people see breastfeeding as an alternative rather than the routine way of feeding a baby. And of course, there's the embarrassment. The popular culture of sexualization of our breast makes some women want to hide the fact that they're breastfeeding. And employment. We know that employed mothers are typically find that returning to work and the lack of maternity leave are significant barriers to breastfeeding. But mothers really shouldn't have to go this alone. This call to action outlines the evidence-based steps that can help overcome some of these barriers. Everyone can help make breastfeeding easier. Whether you're a clinician, a family member, a friend, or an employer, you can play an important role in helping mothers who want to breastfeed. We specifically identified about 20 action steps that are highlighted in the executive summary for you. You know, mothers and their families. Mothers, we need to give them support and encouragement in the breastfeeding that they need to breastfeed. In past generations, there was often someone in the family, a grandmother, or aunt, or sister, who knew how to breastfeed. We're seeing this less and less now. And there are not often enough opportunities for new mothers to communicate with other breastfeeding mothers to learn from each other. We need to take advantage of the programs that educate fathers and grandmothers about breastfeeding. Spouses and other family members often lack that information they need to know what they can do to help. And we have community organizations ready to help with this education. The workplace is another place. Mothers often lack clean, private place where they can breastfeed or express milk. And without maternity leave, many mothers have to return to work before they are adequately prepared to breastfeed. And we can remove some of these barriers, particularly things that the employers can do. They can start and maintain high-quality lactation support programs. And they can provide a clean and private place for mothers to breastfeed, other than a bathroom. And we are working toward establishing paid maternity leave for employed mothers. You know, the workplace programs don't have to be expensive, and employers often find that the programs are very worthwhile. For example, the Mutual of Omaha found that the healthcare costs for newborns are 3 times lower for babies whose mother participate in their company's employee maternity and lactation programs. And AOL has a lactation and maternal care program that yielded similar results. And you're going to hear a little bit more about that a little later. 95% of the babies in the United States are born in a hospital. And that means the hospital really is an excellent place for education and consultation on breastfeeding. And once the mothers go home from the hospitals, the mothers really still need support to continue the breastfeeding. And support from the healthcare professionals is really important during that time. Some of the things that the health systems and the maternity practices can do is that they can develop systems that ensure this continuity of the skill support for lactation between the hospital and the healthcare settings and in the community. The hospitals and the healthcare system can provide breastfeeding education and training to our health clinicians who care for women and children. And we can ensure that they have access to international board-certified lactation consultants. And they can also ensure that the marketing of infant formula is conducted in a way that minimizes the negative impacts on exclusive breastfeeding. The community is really where women can turn to other mothers who are knowledgeable and have that previous experience. And the community can actually help make breastfeeding easier by strengthening those programs that provide mother-to-mother support and peer counseling. And again, using those organizations to promote and support breastfeeding. Things that the policymakers can do. They can support small nonprofit organizations that promote breastfeeding. And we'd like the policymakers to support compliance with the International Code of Marketing of Breast Milk Substitutes. And increase the funding on high-quality research on breastfeeding and support better tracking for breastfeeding rates and the policies and how they affect breastfeeding. And for us in public health, we can improve our national leadership on the promotion of and support of breastfeeding. And finally, the decision to breastfeed is really a personal one, and no mother should be made to feel guilty if she cannot or does not want to breastfeed. However, the success rate among mothers who do want to breastfeed can greatly be improved through an active support of their families, their friends, the community, their clinicians, healthcare workers, employers, and policymakers. And as you're going to continuously hear me say, everyone can help make breastfeeding easier. And so thank you so much for being here this morning, and we're going to talk to a couple of very exciting and interesting women in just a minute. But before that, I want to acknowledge some of the people in the audience today that really helped us put this together. And if you would, just stand when I call your name. Debbie Whitford, Director of USDA's WIC program. Jana Berquist, yes, Acting Chief of Staff, Department of Labor, Wage and Hour Division. Robin Stanton, Chair of the United States Breastfeeding Committee. Where did she go? Oh, there you are. They're meeting tomorrow, right here in Washington. It's starting tomorrow, so thank you for being here. Dr. Lawrence Grumman-Strawn, Chief Nutrition Branch, CDC, and he's the Call to Action Scientific Editor. Dr. Susan Haynes is Senior Science Advisor with the HHS Office of Women's Health, and she's the Call to Action's Managing Editor. Mary Beth Bigley, Acting Director of Science and Communications in my office, is a contributing editor. And would the other members of the Federal Steering Committee please stand? Do you have any more in here? They're shy. Thank you all for putting this together. Now I want to tell you about these young ladies that are here with me on the stage. And They're going to show us how to put some of these action steps to use in practical use and how they have been in real life. Our first speaker this morning will be Tanya Lewis. Tanya is a best-selling author, award-winning TV producer, lawyer, and a breastfeeding mother. Tanya released a documentary entitled Crisis in the Crib last year after learning of the high infant mortality rates among African Americans. She also serves as a national spokesperson for the HHS Office on Minority Health. We have Dr. Shahara Long. Dr. Long is also a mother and has become an expert on balancing her priorities as a mother, practicing physician, and community leader. As a founding member and president of the District of Columbia's Breastfeeding Coalition since 2004, Dr. Long is an active breastfeeding education and advocacy on a national and state and local level, and even on a personal level. She is assistant clinical professor of pediatrics here at George Washington University. And we have Dr. Gillian Pond, Vice President of the Total Awards and Operations within the HR team at AOL Inc. She's the mother of 2 children and a graduate of AOL's Well Baby program. Dr. Pond oversees AOL's Well Baby program and serves as an inspiration to employers across the nation. AOL was recognized as a 2010 Working Mother 100 Best Companies. So now I will present to you Tanya Lewis.
Thank you so much, Dr. Benjamin, for calling on me to be a part of your call to action on breastfeeding. As a mother and a member of a community, I care a great deal about our future. I know our children are the resources that we need to make this world a better place as it continues to evolve. And as a woman who went through it herself, I know that as natural and as wonderful as breastfeeding is, it is not so easy. I mean, it's like walking, right? I mean, walking is very natural. We learn how to walk. We stumble and fall. We get back up and try again. We don't just give up. But we do it because we keep trying because we have people there cheering us on, telling us, you can do it, you can do it, you can do it. And that's what we need as a community. Every woman needs the support for the choice to breastfeed. And in the end, we all benefit. To get more women to breastfeed, I believe we need to enlist the help of men and grandmothers. When I was struggling with breastfeeding, I needed my husband to let me know that he thought it was beautiful to watch me breastfeed our children. I needed my mother to remind me to be patient, that my baby was getting plenty of milk. I needed to connect with my girlfriend, who miraculously, I had some challenges initially at breastfeeding, and I went to visit one of my girlfriends who had a freezer full of expressed milk. I was amazed. So I needed her support and her suggestions about how she was able to accomplish that. She taught me how to settle down and relax, to get down to the business of giving my children the strong foundation for the rest of their lives. And one of the most beautiful aspects of breastfeeding that I found is the bond that it creates between a mother and her child. The child is literally just close enough so that the baby can study mom's face, bonding with her, developing a sense of comfort and security. And mom is able to gaze at her baby and deepen her attachment. As the saying goes, breast is truly best. And breastfeeding is truly the best gift any family can give to their baby. And as a community, that gift pays forward in a myriad of ways. After all, our children will be running the world one day, and they need to be healthy and strong to do so. And that's why I come here today. This is about our future. And this is about giving our kids the foundation. As Dr. Benjamin mentioned, I've been involved in a campaign that raises awareness about infant mortality. I know how many babies we lose unnecessarily. As she said, it's a woman's choice. No one should feel guilty. No one should feel bad if they can't breastfeed. but breastfeeding really is the best. Give it a try, and if at first you don't succeed, don't give up. Keep trying, and hopefully your community is there to cheer you on. Know that I am here cheering you on, as well as all of us who are here. Thank you so much. And now it is my pleasure to turn over the podium to Dr. Shahara Long. Thank you.
Thank you, Tanya, and thank you, Dr. Benjamin, for giving me this great opportunity to be here today. So, like she said, I'm here wearing a couple hats. I'm first of all a former breastfeeding mom. My children are here today, both 8 and 5, so not currently breastfeeding. And I'm also a community pediatrician and the president of DC's Breastfeeding Coalition. And so with that, I'm pleased to be able to talk about one of my favorite topics, so much so that my 5-year-old, when I asked what I did for a living, I'm proud that I trained here at GW to be a pediatrician, but I asked what he thought I did for a living, and he said breastfeed. I'm showing, hopefully creating a very supportive husband, like Tanya said. So I plan to just speak briefly about some of the things that the healthcare and community leaders in the district have done to actively support breastfeeding, and hopefully inspire you to take back some of what you hear to your own community, and hear that, we're a committee of about 20 people with not a lot of money. So it's not something that takes a lot. It just takes ideas, energy, and a will to do something when you see things that need to be changed. Just a little background about the coalition. So we were initially one of the Office on Women's Health's community demonstration projects to locally promote the National Breastfeeding Campaign. So we came about in 2003 and decided, once that task was over, we were the DC Breastfeeding Task Force at the time. Once that task ended, we had so much energy that we didn't want to see it go to waste. And so we reorganized as a coalition, and we're, a bunch of lactation consultants, healthcare providers, business leaders, La Leche League members, breastfeeding moms, of course, and then hospital representatives from DC and the birthing center here. So we've dedicated ourselves to both education and advocacy efforts, and I'll talk a little bit about some of those today as things that we've done in the community, not just here in DC, but to try to improve breastfeeding across the nation. So, and one of our major efforts that I'm proud to talk about is a collaboration that we had with the United States Breastfeeding Committee and the Federal Affairs Office of the American Academy of Pediatrics. And funded by the DC and Virginia chapters of the AAP, we organized the first regional breastfeeding advocacy day in 2009 to promote the Breastfeeding Promotion Act. And we just elected a new Congress, so I'm suspecting, since it didn't pass, that we'll see it again, and that's definitely something that, hopefully you guys will take back to your community, is if you don't let your elected officials know what's important to you, they won't care themselves. So when Representative Maloney from New York introduces the Breastfeeding Promotion Act, we'll always have tools available on our website that you can go to and download to take back to your community. You don't have to be in DC. You can go to their local office. They love to hear from you. And, it doesn't mean that they'll definitely co-sign, but if you can get them to, the more names that you can get on the bill, the further it'll get in the House and the Senate. So then some other things that we've done, just specifically with the healthcare action steps that Dr. Benjamin has in her call to action. One of them that we've really taken to heart here in DC is to ensure that maternity care practices throughout the United States are fully supportive of breastfeeding. And this, was kind of birthed, an idea that was birthed out of experiencing as women some of the unsupportive practices that often happen in hospitals. We came up with the idea to, see what actually happens in DC hospitals. We have a lot of distinctions in DC, and one of them is we have no baby-friendly hospitals to date. So we thought, the hospitals have to be doing something that's supportive of breastfeeding. Let's see what they're doing. So we put together a proposal that the Office on Women's Health funded to evaluate the policies and practices and also the websites, because we're all kind of techie these days. And we looked at them, we did interviews to see, which facility was most supportive of breastfeeding. And we used the 10 steps to successful breastfeeding from the Baby Friendly Hospital initiative to develop survey tools to create this evaluation. And we awarded the most breastfeeding friendly, and then went back and educated the hospitals and showed them, where they were doing a great job and where they could do a little better, and went back to see what they were doing. And it was amazing. The spirit of competition in hospitals is fabulous. So if you can recognize hospitals that do well and encourage others to do better, we went back and awarded not just the best, but the ones that made the most improvement. And, hospitals actually tried. They saw the hospital that won got a beautiful plaque and bags that didn't contain formula to pass out to their moms. And one of the hospitals actually had to put them together for another one. And so the neonatologist said, "What are these bags for? Are these ours?" And when he found out they weren't, they worked on their policies so well so that they got some bags the second time around. And so that's just one thing. And then from that, we, with the connections that we were able to make with the hospitals doing that process, we established the DC Perinatal Lactation Quality Care Collaborative, which is, not an idea that's unique to us. I was invited to the CDC's national strategy to address, or meeting to develop a national strategy to address maternity practices that relate to breastfeeding. And one of the ideas that came from that meeting was to give the hospitals a forum, create the environment so that they can come together and talk about what they're doing, what obstacles they're facing to becoming more baby friendly. And, some hospitals have shared successes, and, we had our second meeting yesterday, and the ideas that come out of those talks was just amazing to me. You could hear the wheels rolling. Oh, how'd you get that started? And you're actually funding your lactation program through rental? Okay, how did that work? And so you could just see, hopefully as we get further along, we'll see the great results of these things that we're doing. And those are all just the healthcare. So with the community part, I'm also a community activist through the DC Breastfeeding Coalition. We've looked at ways to strengthen programs that provide mother-to-mother support and peer counseling that Dr. Benjamin calls on, and ways to use community-based organizations to promote and support breastfeeding. And another result of the hospital project that we did was, we saw across DC the great disparity that Dr. Benjamin talked about. There's hospitals where the breastfeeding rates are in the 90s, and then there's another community where breastfeeding rates are no higher than 30 to 40, and I'm not talking about exclusive, I'm talking any breastfeeding rates. And so we've, sat down and thought, what can we do? And so one thing that we're very excited about, we just partnered with one of the local children's hospital, actually where I work. Their local WIC clinic partnered with us to obtain funding from the state agency to establish a east of the river lactation support center housed in a WIC clinic that's also within a community health center, so that we can reach some of those moms and provide prenatal breastfeeding education and the postpartum support that's so desperately needed to get them off. Once you get off to a good start, you need someone in the community to help you keep going when things don't go so well. Our hope is to have a full-time peer counselor there, and also a lactation consultant to hopefully train her so that at some point she'll be able to become a lactation consultant. And, we're just doing what we can with what we have. And I'll close now before I turn the podium over with, I couldn't escape that, we're so close to Martin Luther King Day, and I'm not Dr. Martin Luther King, but I also have a dream. And my breastfeeding dream is that one day we'll all do our part to ensure that mothers who choose to breastfeed receive the support they need to successfully do so from their peers, employers, their healthcare providers, and the community at large. And with that, I'll close, and thank you for your time, and I'll now turn the podium over to Dr. Jillian Pond.
So it wouldn't be a corporate presentation without a PowerPoint, so I figured I would entertain you all with a little fun of our new canvases representing our AOL brand. So I came, and thank you, Dr. Benjamin, for inviting me to this call of action. We at AOL believe this is a really important topic and have been focused on it for quite some time. So we figured we would share a little bit with you today so you could hear some of the success stories that we've experienced for the last almost 10 years. Here we go. So today what we're going to cover, just a couple of little working mom stats, go over what our program entails, talk a little bit about how we support the breastfeeding agenda overall, and then actually cover some ROI, because everyone wants to know, how much does it cost and is it worth it? And the answer is yes, but we're going to tell you why. So most of you probably know this, but just to recap sort of where we're at from women in work, 64% of women in the workforce are of childbearing age. Women with children are the fastest growing segment in the workforce. And AOL's current workforce is about half female and mostly in the mid-30s. So there's a little setup. So then when we started looking at what we were going to do for this program, just an interesting fact of ours, we launched this program in 2003. And why did we launch the program? Well, we launched the Well Baby program because we looked at our medical conditions, and it just so happened we actually were probably average age of 32 at the time. Pregnancy was our #1 medical condition. It wasn't chronic disease. It wasn't anything serious. It was pregnancy, 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 pregnancy. Everywhere you looked, there were moms, expecting moms, babies, and all that good stuff. So we saw that as an opportunity and a way to support our community of employees. So we launched the program, and it was really the cornerstone to our overall wellness program, which focuses on physical, emotional, and financial fitness. So what we have experienced since we launched the program in 2002, when we started, is the program was initially, from a survey standpoint, at about 54.5% of breastfeeding mothers. And then within a year, we're at a 98% breastfeeding rate. So it went from 2002 to 2003 to 98%. So within 1 year of launching the program, we were pretty much far beyond what we ever expected. And the program really has a couple key elements. And what's important in connection with the breastfeeding agenda is that it's this, what I keep hearing, recurring message of support. And the program is all about being multifaceted. It starts at preconception, counseling for people that are even thinking about becoming pregnant. We have a rich infertility benefit and how to help people that are having more challenges even becoming pregnant understand the process and get the most success. And then from there, we also have obviously the support throughout the pregnancy and in each trimester and what's important. And then from there, obviously, once the delivery occurs, we have the lactation and breastfeeding program. And then followed through that, we actually have counseling and coaching through the school age. So the program is all inclusive. It follows folks. Our Well Baby clinicians and lactation consultants call and say, wow, I have like graduates from 6 or 7 years ago still sending me Christmas cards. And I said, of course. They've kind of bonded and formed their own little family or community within our population. The other thing that we can attribute from a success standpoint is when we built the program in 2002, we have a great partner in Inova Health Source down here in Virginia. And that partner and all the clinicians that are part of the program have been with us the entire time. We haven't had any turnover of the program, and we have that great commitment from those professionals to keep the program going in the success in the process that we have today. And then we also, just to kind of cover off how we have augmented the support of the breastfeeding agenda, we today have 19 mother's rooms in 15 cities across the US. They're all lovely new designs and highly conducive. We also supply 2 styles of breast pumps for your choice and pleasure so that you don't have to lug materials and things all around. And we make things as easy as possible for our working moms to take advantage of the opportunities in the program. We also have consultations. So the program itself, from a Well Baby standpoint, ranges in things like phone calls, emails, seminars, that are what to expect when you're expecting type logic and following all of the good guidance of all of you health professionals out there. But then it also has some new technology things like consultations over Skype around breastfeeding, things you would never see and expect to see over the World Wide Web, live and in person happening across our nation and for all of our employees. So we try to take advantage of the technology we have available at AOL, maximize that. And we've really seen, and I'll just run some numbers for you. We've had over 5,000 emails on the program in 2010, 1,500 on lactation specifically, 1,000 consults, 350 for lactation, and 1,500 phone calls. And so what we really experience through this program is a high sense of high touch, a high sense of outreach. And then not only is it with the clinicians and the practitioners, but also with the mothers in the program itself. And the program's available to not only working moms at AOL, but to spouses. So if someone is a father working at AOL and their wife is at home and expecting, and they themselves can attend the program, as can their spouse, and also to dependents for any of our workers that have dependents that would be experiencing a pregnancy. So the other element of this, obviously, that's important to businesses is the cost avoidance or the reduction of expense. And so we see that, obviously, from a pediatric standpoint, and I think that was mentioned from the Mutual Omaha, and we see the same thing. But I'll give you some more actual numbers. So what we've seen from the program overall is a huge decrease in the C-section rate. We're down to 10% now, and that's something that we're really proud of at AOL. We also see the preterm rate dropping to about 2.3 last year. We also, obviously, I mentioned the breastfeeding rate at 98%, and we have incredible employee retention over the 90th percentile coming back to work and staying at work. So we really had phenomenal results with the program. We can pay for the program for a year with the avoidance of one preterm delivery. It's amazing. So it's definitely something that we understand makes smart business sense, but also supports the employees. And I thought I would close with just some specific comments from the employees themselves, because that kind of personalizes it for you guys. So here we go. I'll just read a few. Being able to breastfeed means so much to me. I thank the support I got from AOL for helping me through getting started and keeping me going for so long. I'm at a year now, and I don't want to quit. Even though I attended classes via phone and webcast, I found the materials and instruction to be so informative and helpful that I didn't even need to take the classes at the hospital. I was very thankful to have this opportunity through AOL and have recommended it to any other mother-to-be I've encountered. My baby got a breast milk for 11 months, and then he got formula, but mostly my milk, and now some solid foods with your fabulous new solids class. He now nurses once in the morning and drinks whole milk the remainder of the day. I was able to contact my lactation consultants at the most difficult point, the newborn point, for guidance. Their information was helpful and assuring, and I found the class helpful, and I knew exactly what to expect, even the bad things. So there you go. I had several friends giving birth at the same time, and I was more successful at breastfeeding and able to breastfeed the longest of all of them. I think I attribute this to having more information and support from the classes in the community and the lactation consultants in particular. And the last one I'll read for you. The Well Baby program staff were beyond helpful. I credit their assistance, patience, caring, and helping me to nurse all three of my children. I've been participating in the Well Baby program since 2003, and it has been invaluable in helping me learn to breastfeed, helping me to work through the hard times, and helping me to stay at work and contribute to AOL's success. I was able to successfully breastfeed all three of my kids, and I'm so grateful for the AOL Well Baby program. So those are just some employee comments. So, I mean, just to wrap up, and before I turn it back over to Dr. Benjamin, I really think, honestly, it's just the right thing to do for our working mothers, and it's been the right thing to do for AOL, and we've seen the success over and over again. So thank you very much.
Thank you. That was really wonderful examples of the things that we're trying to put in the paper. And particularly the fact that many of our women are working today and in the workforce, and they have to work. We have to try to encourage our culture, our society, to make it much easier for women to breastfeed. It's hard to ask for time off or to take breaks, particularly if you're a low-wage earner, to ask for a break, but we should have a clean, private place where a woman can go and pump or breastfeed, and she shouldn't feel guilty to ask for a break so that she can do that. So thank you very much, and the examples were wonderful. It kind of brought this report, this call to action to life, and I'm gonna, in a couple of minutes, just open it up for questions. But I wanted to recognize the Director of the Office of Women's Health, who's sitting in front. Dr. Ashgrove, you want to stand up? Thank you for... I'd also like to let you know that this press conference is being webcast live, and if you'd like to view it later, it's going to be archived on our website, www.surgeongeneral.gov, and it should be available for you in about 48 hours. And also, if any of you want to have a copy of that for your organizations, we're welcome to get it to you. Our staff will get it to you if you'd like to have any parts of this or the whole thing. So before taking questions, I want to share with you a public service announcement that was prepared for this call to action. We'll be making this public service announcement available to 1,200 TV stations across the country. Hello, I'm Dr. Regina Benjamin, U.S. Surgeon General. Breastfeeding is a preventive measure that can protect babies from illnesses and infections, and there are also health benefits for mothers. While 75% of American mothers start out breastfeeding, only 13% of babies are exclusively breastfed at the end of 6 months, and the rates are much lower for African American infants. Whether you're a grandmother or an employer, you can help make it easier for moms to breastfeed. For more information, please go to surgeongeneral.gov. Thank you. I've asked Dr. Lawrence Grumman-Strachan, our Chief Nutrition Branch for the CDC, and our scientific editor to come and help field some of these questions if they get too scientific for the rest of us. He's the expert. So I'd like to open it now to any comments or questions that any of you may have.
Hello. Thank you so much, Dr. Benjamin, for this wonderful and comprehensive call to action. I'm Robin Stanton, Chair of the United States Breastfeeding Committee, a coalition of over 40 nationally influential organizations, educational, professional, governmental groups. On behalf of the millions of mothers and children that we represent, our member organizations represent, we are thrilled with this report. As Surgeon General, I have a question for you. This is your very first call to action. What made you choose breastfeeding as your focus?
Well, prevention is the foundation, again, of the public health service, and it's the foundation of my work as Surgeon General. The Affordable Care Act has allowed me to be chair of the National Prevention Council. Everything that I'm doing is about prevention, and this is one way that we can actively show how to prevent things, and there's no better example than breastfeeding. So it was just a natural, very much so. Thank you.
Hi, I'm a mother of a 20-month-old daughter.
Beautiful.
And she was very excited about the reduced cesarean rates. I am a demographic of women that is very popular, at least in DC, or very common, who thought breastfeeding was gross and weird, and now I'm still nursing my 20-month-old. And so I think this is fantastic way to educate everybody and give women who want to breastfeed the opportunity to breastfeed. My question, though, is whether or not there are any plans in this to support breastfeeding beyond a year, because there are a lot of resources for infants, but I find it difficult to find resources for nursing a toddler.
Would any of you like to?
I'll address that. I don't think that the document focuses on any particular age. It's not only for infants. We're trying to reach out to communities and medical professions to provide support for breastfeeding as long as women want to. And we're not saying for the first year, we're saying as long as they want to, and certainly encourage continued breastfeeding as long as mutually desired.
And to have people like you to help advocate for us. I mean, there's no better examples than people who've done it themselves and can tell their friends and their colleagues and just speak positive and kind of change that culture.
Hi, Dr. Benjamin, esteemed guest. My name is Diane Spatz. I'm a nurse, researcher, PhD prepared nurse at the University of Pennsylvania and Children's Hospital of Philadelphia, and I chair the American Academy of Nursing expert panel on breastfeeding. I thank you for letting us be part of this. I'd like to ask you to comment on action item 9 and 10. Nurses are the largest health profession in the United States. But in the specific action item, it talked about access to skilled physician lactation support or lactation consultant support. It did not talk about nurses. nurses play a critical role in bedside support. In the action item on education, we know that education is necessary, but few programs address the educational needs of nurses, and there's currently no link to licensure or certification. So I'd like to hear your thoughts and comments to really have this happen so that families get the critical access to lactation support that they need from the largest health professional organization.
Well, thank you for that, and thank you for all your support and for what you do. It was by no way meaning to slight nurses. Nurses tend to have a little better understanding than physicians. And so we were really trying to focus on where, I guess, the high-hanging fruit are. And, and that's not to slight physicians, it's just that we could do a better job of training in this entire area. And many of the lactation specialists are also nurses, so oftentimes it happens, and so there was no slightness there, but your point is very well taken. You may want to answer it more scientifically.
I don't know about I don't know that there's a more scientific answer to it than that. Clearly, in the background of the document, we talk about many of these issues, including nursing. When it came to selecting what the most important action steps were, we had to be somewhat selective. We solicited input from across the country, had 2,300 responses on what needs to be done to improve the support for breastfeeding. There was no way that we could write a call to action that would cover 2,300 different recommendations. And so we had to pick the things that we thought were the most important issues to deal with. We don't mean to leave out certain sectors, but we really wanted to focus on the ones that really need a lot of attention right now. And as Dr. Benjamin just said, we really think there's a strong focus on physician education that's really needed right now.
And we may have given nurses more credit. But to address your issue about the licensure, many of I was on the licensure board for 14 years and immediate past president of Federation of State Medical Boards. When we come to licensure, we try not to tie one specific thing to your license. We try to encourage a number of things. I think instead of being one specific thing, you'll begin to have every disease or illness to tie to your license. The better way is to get it on the licensing exams. And to get the questions on the licensing exams. Students study for the exam. Institutions want their students to do well, and if they know those questions are on the exams, they'll teach to that, which is great. Yeah.
How do we do that?
We talk to the licensing community, and that's easy to do, and I'll be speaking to them in April. And I'll bring that up. Here were some other hands.
Good morning. My name is Maureen Lopina, and I'm here representing La Leche League International. Each of you on the panel spoke about the importance of community support, and I just wanted to say La Leche League is so grateful to you, the Surgeon General, for this call to action. And for those of you who aren't familiar with La Leche League, we were founded over 50 years ago to provide mother-to-mother support, evidence-based information, and encouragement to breastfeeding mothers. And we work on a very personal basis. We take emails, we take phone calls, we lead meetings in our communities. In fact, my monthly meeting is tonight. Our meetings are free. They're open to all women with nursing children of any age, including 20-month-olds. We welcome grandmothers, childbirth educators, doulas, any women who want to come to our meetings to learn more how to support breastfeeding are always welcome. We are all over the country. We are all over the world. We're all over the metropolitan area here. And I just wanted to welcome anybody who needs our support. You can find us on the web at lalecheleague.org. And thank you again to all of you panelists and to you, Surgeon General.
Thank you.
Hi.
Hi.
I'm Judy Palfrey, the immediate past president of the American Academy of Pediatrics, and just so happy to be here, and this is a wonderful call to action, and so proud of Dr. Long for what the young physicians are doing. And that's really my question. We hear about AOL, a natural community that's there, there's leadership, they come along, they say, we want to do this. How do we help our communities form these natural bonds, these support groups. Because obviously it's that high touch, high care. And I think what you're doing, Dr. Long, is very much, part of that. But have you got some thoughts in terms of maybe a Surgeon General's commendation for a faith-based group that works together, or for a community neighborhood that comes together? Some way to bring our communities together around this?
I haven't, but that's a great idea. I think, particularly with we can easily give an award or a Surgeon General's medal or Surgeon General certificate for something, and we could probably come up with that. And I have some wonderful staff here can help me work that out. I think that's a great idea. And we've been working with the mega churches, with the faith-based community, with our Office of Faith-Based, and I think we could easily bring that. I've been working with them on flu vaccinations and getting everyone in their congregations to get their flu shots. We can do the same thing with breastfeeding. So I think that's a great idea. Some of you may have some other ideas.
I mean, it's an interesting idea, and I think making opportunities available, folks that are interested tend to find them. We've found ways to we have a Facebook page, so we're going where the communities are. So I personally banned Facebook from my life until someone said at the USBC conference, you need to go where your community is, and so I have a coalition Facebook page. So making things available and getting the information out. I think the breastfeeding mom is actually our Facebook coordinator. So making sure that when there are opportunities to get involved, the information gets to the people that need to find out.
I also think that what AOL is doing could be replicated in other places. And I don't know, as you mentioned, the faith-based community, how people can look at exactly what AOL is doing and take it as a community and use that as a model, and get the community to be the corporation that supports people. I mean, I know things like that work. How to actually do that, I don't know that AOL necessarily has a program in a box that they can, but I mean, that's the kind of thing that you really need, is sort of a program in a box that community organizations can take and then replicate throughout, which could be helpful in some ways.
I guess similar to the business case for breastfeeding, the community case for breastfeeding.
Mm-hmm. Yeah. Tanya, the numbers of African American women who breastfeed is dramatically and significantly low. Young women look up to you and your husband, Spike Lee. Can you speak to that a little bit, how we can try to engage our African American community a little more?
Yeah, it's interesting because I think sometimes, people think of it as being somewhat granola or way out there. Often, and I mean no disrespect to anyone who I may be referencing, but I know, sometimes, the dreadlock sister who, has the Birkenstocks and the baby and the sling, and, that just seems so far out to people. As opposed to someone like me, who's certainly a lawyer and more corporate-looking, or appearing. And I think for people like us, people need to see that we do breastfeed. I mean, I did carry when my children, I have a 16-year-old and a 13-year-old now, so it's hard to remember way back then. But I did carry my baby around with me, and I did breastfeed, rather openly and freely in the areas that I was able to. And I think people just need to see it. I'm sure she wouldn't mind me mentioning, but the woman who I was talking about, who had that freezer full of milk, was Deborah Roberts, Al Roker's wife. Again, people who you would not necessarily think represent the image of someone who breastfeeds. So I think those of us who are sort of in the mainstream, need to come out a little bit more and let people know that we do it. And as I said, it's not always easy to do, and I think that's what happens. You know, we start out with the best of intentions, and then our breasts get huge, our nipples are sore, and it's hard, and you know, formula's right there, and you know, we give up so quickly. But with the support of our friends, you know, we can stick it out.
And I guess while we get the microphone, is there a way to get men involved? Any of you want to answer how to get men involved?
Well, I'll tell you, my husband's a little weird. He used to say, "Oh, I want to taste some." I'd be like, "Ew, that's so weird." You know, but I appreciated the sentiment, I guess. But I mean, that's so key. I mean, I've heard people in my travels, young women, talk about how their men don't want them to breastfeed because they're afraid their breasts are going to sag. Or, as you know, you mentioned, Dr. Benjamin, the breasts are for the men; they're not for the babies. And I think that, I don't know about the Lactation League. I mean, you mentioned that you have support for women, but we need to figure out some support for men. Men need to really begin to understand, I think, what breastfeeding really is about and how they can be supported and not just sort of shunned. You know, I think often when women have babies, men feel like there's no space for them. They're trying to figure out where they fit. And we have to bring them in and figure out how to make them a part of the whole process, and then they can better support us.
Great. Thank you.
Thank you. My name is Linda Harmon, and I am Executive Director with Lamaze International, and we are thrilled with the report, and I'm excited because it supports one of our key practices in our childbirth education efforts. And one key piece we see, of course there's not a magic bullet, is that women must be clearly supported in pregnancy and birth, that there's many factors that can really impact a safe and healthy birth with the preparation for childbirth and in the hospital practices that we know can create barriers. And so my question is, why isn't birth and the birth practices that are in hospital that can really impact safe and healthy birth and breastfeeding success addressed in the report and call to action?
I think we do address maternity practices in the hospital, including that full spectrum. We chose to focus on the baby-friendly 10 steps as the key steps that need to move forward with breastfeeding. Certainly mentioned other practices in terms of C-section rates and the concerns that we have about high C-sections interfering, issues about drug use during labor interfering with the implementation of lactation. Certainly these are important issues as well, but in terms of kind of what we're ready to take action on, we felt that we really needed to have a strong push in terms of baby-friendly, and so we really pushed the action step on that regard.
Can we return to the question
Yeah, we
about
had a man.
my husband?
I got a man.
Yes,
There's a man.
I want to hear what he has to say.
I just want you to know I'm breaking the line.
I'm Greg. I'm actually Shahara Long's husband. Just to comment on the the men part. I happen to facilitate a class, a fatherhood class, along with the childbirth class at Washington Hospital Center. And one of the things that I've learned in dealing with dads is someone mentioned that there's a separation. And one of the things that I do see is that the moms or there's not enough push in letting dads know that you're needed. So when I do the class, a lot of men really don't know where they fit in. So they really look forward to the age where, like a toddler. So it's almost like, well, when they start to walk and I can play, then I'll be a dad. But up until that point, the baby is mom's. So, with my wife, I saw the need to, as me being a dad and a husband, to be a partner, to encourage, to look for ways to actually support her. So I think, when it comes to, being a dad, that part in supporting your wife and still being a dad, meaning you're still helping your child, I think that part is kind of missing. It's kind of a dark area.
Great. Thank you.
Hi, my name is Sally Greenberg. I'm executive director of an organization called National Consumers League, and I'm just delighted to be able to be a part of this. We gave an award to the Surgeon General last fall at our annual dinner. And the organization's been around since 1899, and one interesting artifact, and then I'll ask my question, is that the women who started the organization were very focused on infant and child health, and kids were safe until they were weaned. And then they were exposed to milk that wasn't safe, they were exposed to water that wasn't safe, they were exposed to food that wasn't safe. So it was the holy grail, breastfeeding. And we need to get back to those days, even though our food system and our water system is a lot safer. One additional point that I think really ought to be mentioned in all of your talking points, and was really a key issue for me, and that is that you burn a lot of calories when you breastfeed. And when you're going full throttle, you can burn up to 900 calories a day. And boy, do I wish I could get those calories every single day of my life. So I think that's a huge talking point, especially for moms who are trying to lose the weight that they gained. Now my question, as you all, some of the members of the panel may know, the IRS decided about 2 years ago that they were not going to give, they were not going to include breast pumps as medical devices, and therefore give people money on their tax-free flex accounts. So we've got one section of the government saying we don't consider breast pumps to be medically useful devices, and therefore you're not going to be able to take them off your taxes. And then we've got this wonderful call to action by the Surgeon General. So we wrote a letter to the IRS, you know, an outraged letter saying, you know, how is it that, and then we listed all the reasons why we think why breast pumps are, in fact, preventive devices. What do we do to bring both parts of the U.S. government together, the federal government together, to be talking out of, to be on the same track on this? Thank you.
Well, this National Prevention Council that I get to chair has 17 cabinet-level members on it, and that would be a place where we start that conversation as we start to roll out the National Prevention Strategy. This would be one of the things that we can bring up in that, and we're at the table together and start talking about how we should do these things, and this is prevention, so we could certainly do it there. And we've never had anything like this before, so this is our first opportunity. So, thanks. We got time
Good morning.
for a couple more.
Good morning. My name is Jean Drummond. I like to refer to myself as a femtenor. I'm the president of HCD International, fourth generation female entrepreneur, all of us of which have breastfed. So this is certainly a generational piece. First of all, I'd like to say thank you so very much for the call to action. It's been absolutely excellent. I certainly appreciate this event. We've had the opportunity over the last 3 or 4 years to support HRSA with the business case for breastfeeding. Ms. Harrens have been very excited about this, so I appreciate you mentioning, because there is a toolkit that is absolutely excellent. My question is really directed to Dr. Fong around, as a small business owner, certainly we are very supportive, not only because of the opportunity that we're working on, but internally. But I love how you are doing this at AOL and just really trying to work with other businesses. How does AOL have an opportunity of mentoring or kind of having a corporate mentor, if you will, that could, I mean, this is exciting work, and even as a small business, though my resources are not as expansive as AOA's, we're still interested. I mean, we have, 40 full-time employees, many of which are women, and want to embrace this. And I just love that, and just wanted to know what venues, what channels do you have that we could encourage other smaller businesses with less resources to realize some of the incredible ROI that you have enjoyed. Thank you.
Thanks for the question. I think this has become a lot more popular in the last few years. It's interesting, when we first started the program, where we were getting the phone calls for best practice benchmarking were places like Canada and, just places that weren't your typical, like, National Business Group on Health was the first group that approached us to actually do an interview about the program, and I believe that was a few years back. And that was when we first started to get some publicity on the program. I think, initially as we started building the program, we weren't sure that it was going to create such a great ROI, and now since we have sort of establish that baseline, we agree it's something that could be transported to many other locales. And it's interesting because we outsourced the program to a third party. They have worked a lot with their staff and their management to sort of translate that to other organizations in the area, and they're launching similar programs. So I do think it's possible. You don't need as expansive a program as we have. We just happen to deliver, 200 some odd babies a year, right? So we have a need for the program like this. I think you can do it at a much smaller scale with, maybe one certified clinician that's on call, and it can be someone that could serve multiple parties or communities. We just happen to have the demand and to fulfill that. But what we've learned is that every employee that we've approached with this program's available, it's somewhat of a church and state. We do a little bit of a, it's your private choice. We don't, we like to keep it as a third party. But we see that the consultants that get engaged have gone out to the community and translated that to many other places because they've seen the success at AOL. So I think they're even noticing it, and they're starting to branch out as well. So.
Great. Thank you so very much.
Okay, I've been told we have time for one more.
Hi, good morning. My name's Aisha, and I'm a current first-year medical student at GW, and I just wanted to thank you guys for being here. This is a great learning experience. I just wanted to ask, excuse me, I'm sorry. I just wanted to ask how you think current healthcare professional students can get involved in breastfeeding advocacy and getting the education to learn about its importance.
You want to try?
So there's the American Academy of Pediatrics actually developed a residency training program around breastfeeding that can be applied to medical students. It's available free of charge on the internet. Having trained in a United States medical school, there aren't standards across the country to ensure that there is training on breastfeeding, and we're actually trying to work to get that training for GW. So when you do your PEDS rotation, you'll get some. But in the absence of a system to make sure that it's done universally, individually, there's tons of resources. Dr. Google is my favorite.
That's a great one to end on. Actually, I'm going to embarrass. I have two students with me that's rotating with me. Can you both stand up? Where are you? Where are they? Oh, okay. And back there. Okay, great. And so it's really nice to end up the fact that the students will be our future, and this idea, this project will continue on. We're dependent on you to make sure that it does. I need to wrap it up, I guess. And so I'm going to end with my story that many of you have heard me tell before about a young girl who was jogging along the beach early one morning before the sun came up. And as she was jogging, she noticed this older guy tossing these starfish in the water. And as she ran, she'd see him tossing these starfish one at a time. And by the time she ended her run, she just couldn't take it anymore. So she went up to him and she says, "Why are you bothering to toss those starfish in the water one at a time? There are hundreds and hundreds of starfish along the beach. As soon as the sun comes up, it's going to dry them out and kill them anyway, so why do you bother? It's not going to make a difference." He looked at her, reached down, picked up a starfish and said, "Because it'll make a difference to this starfish." And he tossed it in the water. I hope that you will leave here today and go out and find your own starfish and continue to make a difference. Thank you so much for joining us, and thank you for your support. Thank you. Thanks.